My name is Scot Ackerman, and I'm a radiation oncologist here in Jacksonville, Florida. I see lots of patients with cancer, many patients with breast cancer and prostate cancer and rectal cancers, and lots of patients with esoteric tumors, ones we don't see too often, the rare tumors, the soft tissue sarcomas and pancreatic cancers and things like that. And when patients come and see me, we frequently discuss clinical trials because that's one of the first things that we talk about, and one of the first things we think of. Do we have a clinical trial available for this patient to be enrolled in? Clinical trials are used to help decide what the best cancer treatment is. It helps us as oncologists figure out what is the best way to treat a certain cancer. Clinical trials sometimes mean a patient might get treatment A or treatment B. Sometimes it means they're going to get the drug or not the drug. Sometimes it means that we're just evaluating the patient along the way and there's no experimental arm at all. But it's important to have a discussion with your doctor. It's important to have a discussion with your oncologist about clinical trials. Because if you are eligible for one, then we could glean information from that'll help us treat cancer patients in the future in a better and more efficient way. And sometimes clinical trials have available to them certain kinds of treatments, certain kinds of radiation treatments or chemotherapy drugs that may be good for your cancer that aren't necessarily available to the general public.
For more information on this type of cancer or any other cancers, please call Dr. Scot Ackerman at First Coast Oncology, 904-880-5522, or visit us on the web at www.firstcoastoncology.com.